You're watching the Emmy Award-winning Richard French live, only on RNN.
This week on RFL, we've shown you what is in the health care bill, who's for it, who's against it, and the extremes. Some are going to try and repeal it. In a second, I'm going to tell you what the real impact of the reform would have on our region's waiting rooms. But first, let me get to a phone call. We've asked you throughout the hour about your reaction, not only to the health care reform, but more specifically, the Republican promises to try and repeal it. We've asked you if you think it was really principled or petty. Let's go to Lorraine. She's calling us from Irvington in New Jersey. Lorraine, what do you think about that? Do you think this, the objections are legit here, or do you think they're playing politics?
They're playing silly politics, and it just goes back to, the haves and the have-nots. If anyone is paying attention, your earlier segment on education costs, all of these protesters that are out there protesting because, we want to make affordable health care, and it's just the beginning. Of course, there are going to be, nooks and crannies to work out, and, they need to concentrate on that. And then they're not even worried about all of the education funds that are being cut by the state, their state that they live in. They're so busy worried about including people that can't afford or do not have or, just aren't able to receive health care, don't have access to it. But they're not even paying attention to all of this education cut?
Lorraine, thank you. It was in the Times today. I think it was David Leonard who wrote it. First time in 10 years, something's been done to try and the income inequality in America is getting bigger and bigger and bigger. This is the first thing, if you think about it, with health care reform, that they're trying to at least make the gap a little tighter. But let's now get back to health care for a minute, and more specifically, trying to put a human face on this. Talk a lot about the numbers and the politics, but Regina Arsanya, she went out to a health care clinic in our region to see how this kind of reform will affect those on the front lines, and she joins us with more.
Well, Rich, just as Democrats and Republicans are fighting over health care reform, doctors and CEOs here at home have very different opinions. But what do patients feel? We stopped by one local community health center to see how the bill will affect them. Like many people her age, Maria Ladislao visits the doctors once a year for her annual checkup. This time, the 48-year-old mother of 3 is on her second visit in a week. She was called back in after tests showed a mass in her left shoulder.
I came in here. They had an X-ray in my arm, and they said they saw something in my arm, and I have to go for another exam, and I don't know what's going on, and I'm afraid right now.
Although Maria's diagnosis may be grim, she says she feels comfort knowing that if she needs treatment or to see the doctor again at the Open Door Health Clinic in Portchester, she can do so even though she doesn't have health insurance.
They give us opportunities to pay, to make the payment little by little. As I told you before, it's going by the income, the number of the family.
Maria's husband works full-time and she works part-time too, but the couple still can't afford health insurance. And it seems they're not alone. Lindsay Farrell, the president of Open Door, says thousands of uninsured families like Maria's, the working poor or those who have lost their jobs and can't afford health insurance, have found their way to the center.
Because of the recession, we're bursting at the seams, and we've experienced almost a 20% increase in new patients in our in all of our facilities. We have 4 health centers, and we have school-based health centers as well. And the biggest number of folks that we're seeing have absolutely no insurance.
In fact, Farrell says 55% of patients at Open Door have no insurance at all, simply because it's unaffordable. And because of local, state, and federal grants, the clinic can help subsidize those costs.
It's not in the top number of items that you choose to spend your money on. So we offer a sliding fee scale here, and how sick they are, and if we have to do lab tests and what have you, the visit can cost about $25 on average.
But others at the center with insurance rely heavily on government-subsidized programs like Medicaid and S-CHIP, the Child's Plus program. Programs that Farrell says will benefit from the health care reform bill.
That's why we're very excited about this legislation, because it's going to expand Medicaid benefits across the country, and there's nothing worse than somebody applying for Medicaid and not qualifying because they make too much money.
People like Crystal Young, a substitute teacher in New York, who doesn't have insurance because it's not offered by her employer.
Basically living paycheck to paycheck, And when you're living paycheck to paycheck, you have to really budget yourself. And that was a struggle, but they were able to help me in those areas.
Crystal not only receives medical but also dental care at the Open Door Health Clinic. And like Maria, she too feels fortunate to have found the help there. But both women say they're looking forward to the day when they too will be granted better access to such desperately needed care.
We have a lot of people out there that are sick, and I'm so happy he passed the bill for those that really need it.
I have a hope. I have a hope something's going to happen.
Even though health centers like the one you just saw are providing care for the uninsured, it's important to remember that these institutions have to exist because there is a gap in the system, a gap which forces the uninsured to seek care in alternative ways. Now, this is just one of the many stories of healthcare hope and horror out there. If you have one that you would like to share, you can email me at rorsanya@rnntv.com. You can see my email at the bottom of the screen. I look forward to hearing from you. Rich?
Tough name to spell. Thank
Yes.
you, Regina. All right, everybody, we're going to be right back with more on a cold case from New Jersey that was cracked 30 years later. Please stay with us.